welcome to episode 12 of Abbey House Dental podcast. My name is Mumta and this is Dr. Annie, and today we're going to talk about smile makeovers. So Annie, this is kind of a really important conversation really you're going to be having today, and probably a very popular one as well.
Definitely.
But I want to start off by talking about smile makeovers. Over the last few years, it's really taken on a life of its own. We have so many new patients, so many of our existing patients as well, coming to see us. And one of the main things that they are looking for is ways of enhancing their smiles. And I think both of us have noticed there's a slight change in the way dentistry is delivered now. So let's start with that first. In terms of, have you noticed a change yourself in the way dentistry is delivered, from traditional ways of just prepping teeth for veneers, composite bonding, things like that, and kind of where kind of ortho comes into that? So
Yeah, so first of all, thank you so much for having me on the podcast. I wasn't expecting to be doing something like this, but no, I'm glad that I'm having a chat with you.
Of course, you're one of our most recommended dentists, and I think a lot of patients are kind of wanting to hear you talk.
Yeah. And
you see such a variety of patients.
Definitely.
And actually it's quite nice to get a female's input,
Yeah.
Let's talk.
No, so dentistry has changed a lot over the years. I'll be honest, I was actually anxious of going to the dentist when I was younger, so it's definitely something that I've noticed doing dentistry. A lot of patients are coming in, they're super anxious.
So you used to be anxious of going to the dentist as well. So tell me what that would feel like for you.
Well, I'd be nervous before the appointment. I'd be worrying about whether I was going to be judged about my teeth, whether they were going to tell me something horrible needed to be done, and also kind of the thought of being someone looking in my own mouth is really personal. It's quite invasive. So that was all going on. So when patients come in and they are kind of saying the same things, I really resonate with them. I understand why they're nervous, and a big kind of priority for me is making the patient feel comfortable when they come to see me, and that there's no pressure at all. I just want to help them. So I think, that's a big thing. And a lot of patients come in and they say that they hate the dentist straight away. And I try not to take it personally, but it's nice seeing the transformation from when they first come in saying they don't like coming, they hate the dentist, to then going through and having a smile makeover and feeling like excited. They're kind of happy with their treatment, and we're kind of on a friend's level, like they're excited and happy.
I think the fact that even you experience this means that you can almost empathize with them, isn't it? To a very you almost come across like you're breaking those barriers. You're coming across like someone that they can almost be able to open up to.
I want them to trust me.
Yeah.
Because there are so many kind of horror stories of dentists in the past, school dentists, and patients are worried, and they sometimes, if they don't trust you, they might not be able to open up about what their worries are with their teeth. So a lot of the time I will kind of ask if they're happy with their smile. Sometimes patients are a bit taken aback and they're like, actually I'm not. I've been really conscious about something for this tooth for ages, and they've just never had that confidence to bring it up before. And then that gives us the chance to talk about how we can help them feel better, like actually want to smile in photos, because it really pains me. It hurts when, not doesn't hurt, it makes me feel sad, isn't it? When a patient says that they don't smile in photos. And I just think we can change that. We can make you feel better. We want you to smile in photos. You shouldn't have to have that as
I think the way I think of it is you only have these years for so long, and you don't want to go through life not actually expressing yourself in your most authentic self, like your purest form. And I think, like you said, a lot of patients that we see, they feel, when it comes to taking photos and things, that they want to cover their mouth, and you're thinking, no, just, there's things that can be done to help you, so just be free,
of course,
and
and you see how a patient first comes in and they might be a little bit more timid, or kind of not feeling in their best self, like they don't feel kind of as confident as what they are after treatment, and they're smiling,
it's like they've had a complete personality change, isn't it?
Yeah. And it's just so nice to be able to do that and to help patients go on that journey.
So kind of in your experience then, what are kind of for patients who might be listening into this, what are the main changes on how we enhance smiles these days?
So I think the first thing is at the general checkup, when a patient comes in to have a chat or a consultation, I actually take photos of their teeth, pop them on the screen, we sit down and look at them together, and I ask the patient what they notice and what it is that I notice as well, and we look at different options as to how we can kind of improve certain things, whereas sometimes patients don't see their teeth on a big screen, and it helps patients kind of understand.
Okay, so a lot of patients that come to see us, so I think one of the stats that has come about is that 75% of adult patients have some form of misalignment of their teeth. So when a patient's first coming into the practice and they want to know about smile makeovers and things like that, one of the first things I'll say to them is just have your teeth scanned and have a look at the simulations. Technology's changed so much nowadays that without even doing anything, they can get a glimpse of what they can look like in the future. What's your experience with that? I mean, have you tried that with your patients? What's been the feedback from them?
Yeah, so definitely, I completely agree. The majority of patients that come through the door could benefit with Invisalign, whether that's kind of for aesthetic purposes or for like even the health of their teeth and their gums. And we take a scan, and it's amazing. You can see the full mouth, and you can see every single tooth, and it's literally we look at the scan together. And
do you know what I think is amazing about these scans? Is when the patient comes in.
Yeah.
So obviously you take the photos, and then we also record a video of them.
Yes.
And once they've had this video recorded, they literally get to see the version of themselves with the smile that they have envisaged for themselves, isn't it? And I think that from a patient's perspective, it's probably one of the most key, important parts of if you are looking to have a smile makeover done. Definitely start off with that bit first.
Definitely.
Because it gives you an insight. It is your smile, it is your face, it is your teeth, and it gives you an insight of what you can look like without even having any dentistry done at that moment in time. And like you said, things like Invisalign, it's a really important component to a lot of smile makeovers because
it's the first step.
It's the first step. So traditionally, when a patient would come in and say they want composite bonding, I mean, me and you were talking about this a moment ago, isn't it? So just talk me through that.
Yeah, so I've recently had, a lot of patients come in and they want composite bonding. They said their friends had it, they want their teeth sorted at the front, and they said, I want composite bonding. But when they come in, when we look at those photos together, I can see straight away that they would really benefit from something like aligning the teeth. By putting the teeth in a healthier position and rotating them, bring them down, bring them out, we can actually basically solve a lot of their main concerns through just aligning the teeth. That means then they don't have to have as much composite bonding after. Their composite bonding might look more natural, and there's less chance of it chipping as well in the future. So they might not have thought that Invisalign is something that they'd want to consider, but after kind of we talk through things, it's definitely the first step that can give them a kind of healthier, happier, long-term smile.
Because, one of the things is most of the patients that come in for composite bonding, have you found this as well, that because the teeth aren't in the right position, you end up having to build those teeth up. So you get a very thick layer of...
It's not natural.
It's not natural looking, is it?
And also for the patient, it's going to feel really bulky.
Yeah.
And it doesn't look natural because of that. Teeth aren't naturally bulky. So you can't... Ideally, we want the teeth to be as natural looking as possible, and by slapping on composite, we can make them look good, but they can get so much of a better result by aligning the teeth first, putting them into kind of creating a blank canvas and putting the teeth in the right position, then going ahead doing some whitening, and then doing bonding after that gives such a good result. And we've had so many cases where we've done that.
So that's similar to you, because you refer to this as the ABC technique, isn't it?
Yes.
So just talk us through that then.
So when a patient comes in and we take some photos of their teeth and we look at them, the first thing I say is, majority of the time, is that we can align the teeth, put them in a much healthier position. Sometimes patients come in and they've had tooth wear. They don't actually have space to put any bonding on their teeth or any restorations, any veneers on their teeth, because the teeth are so tight together. So actually aligning the teeth creates a little bit of space for us to be able to actually put bonding on their teeth long term. So aligning the teeth is that first step, and it solves so many of the problems. It means that we need to do kind of minimal steps. So the next step I would say would be bleaching the teeth. So whitening, and that creates again another blank canvas. Everything looks the same shade, it looks brighter, it makes everything look 10 times better. And then from there, rather than doing a lot of restorative work, we can do minor tweaks here and there with a little bit of bonding just to enhance the smile. So yeah, those 3 steps: aligning the teeth first, bleaching them, whitening them, and then finally a bit of bonding. It looks really, really good.
Yeah, and I think you touched on something really important there, that for a lot of patients, composite bonding will only last so long if it's done really, really well. Yeah. And one of the most important factors is your bite. Mm-hmm. So if you have teeth that are literally touching edge to edge, then there is going to be no room to have some bonding, to have the resin placed on the edges of the teeth. And this is where repositioning the teeth, using something like clear aligners, using something like Invisalign, will help increase the longevity of those of those restorations, isn't it?
Yeah.
So, no, I mean, we talked about bonding there, but I've also noticed a trend with things like veneers and crowns, and we recently heard a lot about things like turkey teeth.
Yes.
Right, where patients are going to Turkey to have their teeth quite intensely.
It's very invasive.
Invasively, yeah,
They're all shaved down, and it's one small fix all for a lot of the cases there.
So why would that concern? I mean, from a patient's point of view, why are dentists so scared that they're going to Turkey to have their teeth shaven down? Like, what are the repercussions of that?
It makes me feel a bit sick, turkey teeth, actually, because a lot of the teeth, when I've seen it myself as well, a lot of the teeth are healthy in the first place. They've never had any fillings on them. And then all of a sudden the patient goes to Turkey or anywhere else, and the teeth are shaved down. Instantly, as soon as the teeth are shaved down, they're at such high risk of kind of future problems like pain, infection, the nerve of the tooth dying off, further treatment needing to be required. And if you imagine, it's such a healthy tooth, you can't go back. And a lot of it is young patients that are going, and as soon as you get work that is that invasive and kind of you can't reverse it. They're going to lose that tooth at some point in the future, and there's so many other ways that we can try and achieve that smile that's so much that isn't destructive.
There is such a big biological cost, isn't it? You might be saving money financially in the very short term, but actually the biological cost to a patient to have their teeth shaven down to such extent puts them at such a high risk of things like nerve damage, nerve pain, having to have that tooth out, and then having to think about teeth replacement, especially if you're so young in the first place.
Of course.
So, I mean, here nowadays, the way we, like you said, we use the ABC technique, right? So when we're assessing someone's smile, we're looking at, first of all, the alignment of the teeth, and are the teeth in the optimal position? Are they in the most healthiest position for those patients? Once the teeth are in a healthy position, then we can do things like even veneer work, that like minimal prep, like contact lens veneers. So for a patient, what does that mean? Like, what does contact lens veneers mean? What does preparation of your teeth for veneers mean? Non-prep veneers, what does all that mean?
Yeah, so there's lots of different types of veneers. Ideally, we want to do kind of the most minimal prep that we can on the teeth. So when the lab make veneers, there's a minimum thickness that they require to make them. Otherwise, there's a high chance they could fracture or they could break down. So we need to we need to kind of prepare the teeth so that we can sit these on. If we didn't prepare the teeth, it could make them look bulky. But nowadays, as kind of the lab work's getting better and better, there's more kind of digital design work, and the lab are coming out with these really thin contact lens veneers that you can literally just slip onto the teeth, sometimes without any prep, depending on the case, and just create a really aesthetic result with kind of minimal damage.
So what are the benefits for a patient to choose? Where does bonding come in, and where does veneers come in? What is the difference? What are the long-term results of them? And what does it mean for a patient?
So first of all, again, this is all case dependent. Every person is different and everyone needs a customized treatment plan. But ideally, if a patient hasn't had any fillings or hasn't had any work done to their teeth before, we want to do as little damage as possible to the teeth. So with composite bonding, we just add a tooth coloured material on top of the tooth without any preparation, most of the time without any anaesthetic as well. So there's no pain, it can be quick, done in a session or so, and we can just enhance the teeth by sticking and moulding the teeth into a better shape, a better colour, and it's quick and it's easy. The only thing is, if a patient has had kind of work done before, they've had crowns, sometimes kind of patients have had them for quite a while, at that point you're looking at kind of replacing those crowns or replacing those veneers long term.
Yeah, so I mean, the other most important part that you touched on just now is if you're a patient that's got just minor tweaks that need doing, then like you said, composite bonding might be the better option for you because it's minimally invasive. There's no preparation as such involved, and you can just add the resin onto those areas that need the slight volume build of colour, change and things like that. I think where veneers really comes into a life of its own is if you're looking for a really long-term kind of glossy finish. So I almost compare, so there's composite bonding and veneers are like the Rolls Royce of cosmetic dentistry.
They're always going to look better.
They're always going to look better.
Yeah.
Because they're made out of, porcelain ceramics, they're made out of, and they look very natural, glass-like.
Yes.
But one of the things, if you are looking to have veneers done, is you want to have an assessment done first to check how much preparation would be required, because nowadays it's all about the biological cost, and it's to try and keep that biological cost as minimum as possible. And where possible, as dentists, we want to preserve as much of that tooth structure as possible for them, because nothing beats having your own natural tooth.
No, definitely.
So I think one of the stats that came out was that 1 in 3 patients would require their teeth to be aligned first before having any cosmetic treatment done, because what that will enable them is to again position the teeth in an optimum position so that when they have the aesthetic work done, they really get the most natural looking confident smile. We were talking about lower crowding.
Yes, so a lot of my patients come see me, and we can see that they've got their lower teeth have crowding. They've all, like, over time the teeth have shifted and drifted forwards, and they're noticing it more and more. They're also noticing that they're getting build up behind those teeth, and we always see it. It's so common to see plaque, tartar, calculus build up behind their bottom front teeth, and it's because those teeth are so kind of crowded. Plaque loves to hide in the little nooks and crannies, and it's so difficult to clean, not just for them but also for us. So luckily the hygienists do it. But if those teeth were aligned, there'd be less kind of areas for the plaque to kind of cling onto. It's easier for the patient to clean, it's easy to maintain long term, and that's something that's really worth considering, that Invisalign isn't just about kind of improving how the teeth look, straightening them, but it's improving your health. So the health of the gums, we can actually reduce kind of early gum disease but by putting the teeth in this healthier position.
I think that's so important that you've said that, because a lot of people don't even know that, when you have crowding of your lower teeth, it is very difficult to clean. Like you said, it can be quite so tricky to clean.
You can't get the T-piece through.
You can't get the T-piece through, and sometimes you try and put the floss through and it rips in half. And actually, by the plaque constantly accumulating behind those areas, you're at higher risk of things like gum disease. So simply by just repositioning those teeth, it'll reduce the plaque retention. It'll be easier for you to access, and much better gum health, isn't it?
And it is. I think it's about 65% of patients have lower crowding on the bottom front teeth. So it's a lot of patients, and a lot of patients are actually, they've had braces when they were younger. They haven't worn the retainers, just either because they weren't told or just because
life takes over.
Yeah, life takes over. And they come back and the teeth have moved. They've relapsed back into that position, and you can see minor tweaks. Well, not minor. You can see crowding, and those are actually the best patients for having Invisalign on, because you know that their teeth can be in a better position.
You know, a lot of patients, I guess, are worried about the time that it takes to straighten the teeth. So if you are a lower crowding patient, if you are someone who has got crowding on the lower front teeth, in your experience, how long does it take to straighten those?
Obviously, it depends on the severity, how crowded they are. But from the cases that I've seen, I'd say an average, maybe kind of 6 months, roughly.
I guess there's several cases where it's actually even less than that. It can even be as little as 12 weeks. You know, so it really doesn't take long at all. And if you consider the treatment time to the lifelong kind of freedom time, it's easily doable.
And this is the thing, if kind of with patients, some of them have had like fixed braces, which obviously sometimes it's necessary, but the advantage of something like a clear aligner like Invisalign is that you can't see it. It's almost invisible, and you can take it off. You can actually clean your teeth really well. There's nothing getting in the way. There's no wires, there's no brackets. You're completely kind of, you can carry on with your normal routine. All you have to do is just wear these aligners, and over time they'll gently push the teeth out into a healthier and more aesthetic position.
I just love the fact that as time's going on, dentistry is really evolving, and things are getting easier and easier for patients to really benefit from. But I mean, we talked a lot about treatments and dentistry and teeth. But I guess kind of another really important part of all of this is you. So let's talk about you. You've been with us for how long now?
I'm gonna have to count.
When did you join us? You joined us last year, right?
10 months.
10 months. Look at that.
So 10 months.
Now. And since you've joined us, obviously you've been doing, like, I say this to you when I walk past you in the clinic, that your photography is like amazing. Your composite one, your aesthetic dentistry. If any of you get a chance to see it, just go onto Annie's Instagram site and just have a look at her dentistry. How did you get to doing this type of stuff that you do?
So I've always kind of been quite artistic, if I'm honest with you. So even like kind of through school, did A-level art, and I've always liked a good before and after. So it's been in the back of my mind when I was studying dentistry as well. I studied in Leeds, so graduated from there in 2021, and I've always it just makes me happy seeing a good before and after. So I did some extra training in the dental hospital, and that was the time where I could basically, it was on a consultant-led clinic, and I was allowed to build up these patients' worn teeth, and I could see that before and after, and straight away I knew that's what I want to do. So I actually I went on my first dental course, and it was in Ibiza.
Amazing.
It was a totally composite Monique Vassant's course. Big up, sorry.
He's amazing. He's amazing.
And it was the only way my parents would let me go to Ibiza. So for a dental course. But it was really good, and it made me realise that's the kind of dentistry I want to do. I want dentistry to be exciting. I want it to be a bit bougie. And you want to be able to create beautiful work for patients with just something simple like composite. So again, when I am doing composite work, it feels like I'm doing a piece of art. That sounds so cringy, but it is what it is. And
I think it's amazing. I think because it is art at the end of the day, isn't it? It's like you're sculpting.
it's really satisfying. And then I went on to do my diploma with Fresh Dental Institute, and that was on kind of restorative and aesthetic dentistry. That actually enrolled me to do Invisalign. And once I did kind of that further training, I realised how important aligning the teeth, doing Invisalign is. Again, I keep repeating it, but not just for aesthetic purposes, but for function, for the health of the patient. And once you get the teeth into those correct positions, it makes life so much easier. It makes things look so much more natural. And patients are sometimes, they might not even need the composite bonding afterwards. Just a bit of Invisalign, a bit of whitening might achieve those results. So rather than trying to hide the problems by covering it up with composite, veneers, whatever, you're actually solving the problem, you're solving the actual issue, and then you don't have to hide anything. Yeah.
I think that's so important what you've just said there, that it is, you're not compromising.
No.
You are actually putting your health first, and actually doing the treatment in a right staged way.
Yeah.
So kind of patients who've had composite bonding, what is the best way for them to maintain those teeth?
So I would definitely say home care is really important. So with composite, it can stain over time. So you do have to be a little bit careful with kind of tea, coffee, red wine. That's not to say don't have it. It's just be a little bit wary of it. And if you come in for, I would say definitely to all my patients that I've done composite bonding on, come in for a yearly composite bonding polish. That's where we'll literally spend our time going through all the polishing steps, making sure that everything's nice and glossy and looking fresh again. So coming for that yearly polish can really help, and maintaining it at home, keeping your oral hygiene excellent. It needs to be that way. So kind of flossing, using an electric toothbrush, all of that can really help.
And in terms of how long would composite bonding generally last, would you say?
I say to patients, as long as they're looking after it, coming in for their polishes, on average about 5 to 7 years. Obviously it's different per case. So again, for patients where they're at higher risk of things chipping, if they haven't had Invisalign before, I can't guarantee that. Because if the teeth are hitting, and if there's so much pressure on any bonding that's done at the front, it's got such a high chance of breaking. So sometimes I even say, actually, no, I don't think I feel comfortable doing this case. I really think you would benefit from aligning the teeth first, because I don't think that the bonding will last.
And I think that's so important. And I think at this practice, I think we all really understand that. So we wouldn't just do, if you came and you asked for composite bonding, we're not just going to put it on. We're not going to just put it on. There's a whole assessment that happens because it's in our best interest, isn't it, that whatever dentistry we do lasts. And we want the patients to ultimately benefit the longest from it. So you're 100% right. If you have bonding done on teeth that aren't in the right position, your risk of fracturing those teeth are so high. And we don't want work that, like, we want the most success out of the work that we're doing, and for ourselves, for the patients. 100%,
but this is the thing, when a patient shows interest and they want to come in for a consultation, it's literally an hour long. We go do a thorough comprehensive exam, we take photos, we take a scan, x-rays, everything, and we will look at it all together, sometimes even kind of together. So as a group of dentists, we'll look at it and we'll plan the case to make sure that we're going to get the best results possible that will last the longest amount of time. And I think that's the really good thing about Abbey House as well, is we've got so much knowledge here, so many dentists with different experience. It's just a really fortunate position to be in, to be honest.
I think definitely. I think amongst ourselves, the amount of knowledge that there is and the skill mix. Most patients, most of our existing patients, they can definitely get a lot of benefit from that, isn't it? Very quickly then, talking about veneers. How long do veneers last on average, and what does the upkeep of veneers look like for a patient?
So with ceramic veneers, they can last a long time. So they can last let's say 15 to 20 plus years, as long as they are done by a very highly skilled dentist, and that the patient is looking after them as well. So in terms of looking after them, making sure that the patient's oral hygiene is excellent, that we're flossing, we're brushing, we're also visiting the hygienist regularly, is super important. Coming for your 6-month checkups, all of this can just mean that those veneers are kept they're maintained at the highest standard, and if there's ever any problems, they can be nipped in the bud straight away. But they're a really good option for those that are kind of suitable. Yeah.
Amazing. Annie, thank you so much.
It's all right.
It's all right. So before we finish this podcast, it's a Abbey House Dental tradition. Okay, so in true Abbey House tradition, we believe that you should always in life be growing and exploring and trying to make yourself better, that 1% every single day. So reading is a big part of us. And here we have a book that is for you. Well, when we read it, we thought of you, and it's called You Are a Badass. Ooh. And it's about
Thank you
empowering yourself.
Yeah.
Because you already are doing these things. And I think that you're ready to take that next leap and step in turning into a true badass. Mic drop.
Yeah.